When you think of colon cancer, you might picture an older person. But here's the truth. Cases are rising fast in younger people, and many of the signs are so subtle that they go unnoticed. More young adults are facing this diagnosis than ever before. Often, they don't catch it until it's advanced because the symptoms can be easy to ignore or misinterpret. In this video, we'll uncover 10 silent symptoms of colon cancer that everyone should know. We'll also explore the best screening methods, key risk factors, and lifestyle changes that could help prevent it. Stick around. What you learn today could protect you and your loved ones. Abdominal pain or cramping. Why is this common symptom more serious than you think? You might think abdominal pain or cramping is no big deal, especially if you've experienced it before after a heavy meal or a bit of stress. But here's the catch. When this pain is persistent and doesn't go away, it could be a warning sign that's worth paying attention to. Many people brush off ongoing abdominal pain as gas, indigestion, or just a sensitive stomach. However, when pain sticks around, it could mean something more serious is happening under the surface. Persistent cramping might indicate inflammation in the colon, or, in some cases, it could signal the presence of a tumor. So, if you're experiencing pain in your abdomen that doesn't seem to get better, don't ignore it. Trust your gut literally. A quick visit to your doctor can help you rule out minor issues and give you peace of mind, or it might just catch something early when it's easier to treat. Now that you know why abdominal pain shouldn't be ignored, let's talk about another symptom that often goes unnoticed: changes in your bowel habits. But first, can you do us a favor? If you find this video helpful or interesting, please hit that like button and subscribe to our channel. Your support helps us create more amazing content. How can small changes be a red flag? Most of us experience changes in our bowel habits from time to time, especially with diet shifts or stress. But if you suddenly start noticing unusual patterns like frequent diarrhea, constipation, or even alternating between the two, it's a signal worth paying attention to. When these changes stick around and don't go back to normal after a few days, it may be your body's way of warning you about something more serious. Colon cancer can disrupt the normal functioning of your digestive system, leading to lasting shifts in your bowel habits. While it's easy to dismiss these symptoms as minor inconveniences, they could be an early clue. If your bathroom routine doesn't seem to settle back to normal, reach out to a healthcare professional. Early checks can rule out other causes and help you get the answers you need. Let's move to another subtle yet important sign, one that's easy to ignore, but could mean something serious: narrow stools. What does the shape of your stool reveal? While it may seem strange, the shape of your stool can actually tell you a lot about what's happening inside your body. One detail that often goes unnoticed is pencil-thin or narrow stools. While most people might ignore this change, it can actually be a sign of an obstruction in the colon. When stool becomes consistently narrow, it could mean something is blocking part of the colon, potentially due to a growth or tumor. Although it's easy to dismiss a change in shape as a one-time event, keeping an eye on it if it happens repeatedly could be crucial. If you notice this change happening over several days or weeks, it's a good idea to bring it up with your doctor. Catching these small shifts early on can make a big difference in your health journey. Now that we've discussed the importance of stool shape, let's talk about a sign that's more alarming, but just as important to recognize: blood in the stool. Should you be concerned about the occasional spot of blood? Seeing blood in your stool can be alarming, but it's also easy to brush off as something minor, like hemorrhoids or a small cut. However, blood in your stool is a warning signal that shouldn't be ignored, especially if it keeps showing up. Blood can appear in different forms. It might be dark and tarry, or it might be bright red. Dark blood usually means it's coming from higher up in the digestive tract, while bright red blood suggests it's closer to the colon or rectum. Both can be caused by inflammation, ulcers, or even tumors in the colon. Although occasional spots of blood might seem harmless, noticing it regularly could be your body's way of pointing out a serious issue. If you ever see blood, even if it seems like a small amount, consider getting checked. It's always better to be safe, and early detection can make a big difference. Let's keep going and talk about another subtle sign, one that's easy to miss, but worth understanding: unexplained weight loss. Could unexpected weight loss be more than a diet change? Many people wish they could lose a few pounds, but if you're dropping weight without making changes to your diet or exercise routine, it's important to take notice. Unexplained weight loss can be a sign that something more serious is happening in your body. When your body is fighting cancer, the cancer cells can consume extra calories. This can lead to weight loss that isn't tied to a healthier diet or more exercise. If you find yourself losing weight without trying, it's a good idea to investigate further. Pay close attention, especially if this weight loss comes along with other symptoms like fatigue or changes in bowel habits. It's always wise to talk to your doctor about any significant changes in your health. Early intervention can be key to getting the help you need. Now that we've discussed unexplained weight loss, let's explore another important sign: fatigue and weakness. When is tiredness a sign of something serious? Everyone feels tired from time to time, especially after a long day. But if you're experiencing persistent fatigue that doesn't go away, even after getting enough rest, it could be a sign of something more serious. This ongoing tiredness may indicate anemia, where your body lacks enough healthy red blood cells. It can also suggest problems with nutrient absorption, meaning your body isn't getting the vitamins and minerals it needs. Additionally, cancer cells can drain your energy supply, leaving you feeling weak and exhausted. If you find yourself feeling tired all the time and it's affecting your daily life, don't hesitate to talk to your doctor. Identifying the root cause of your fatigue early can lead to better health outcomes. Now that we've looked at fatigue and weakness, let's examine another silent symptom that many people overlook: anemia. How can low iron levels tell you more than just your diet? Anemia is a condition where your body doesn't have enough healthy red blood cells to carry oxygen. It's often discovered during routine blood tests. While it can be caused by a poor diet, especially low iron intake, it's unusual for younger individuals to experience anemia without a clear explanation. If you're feeling fatigued or weak and your doctor tells you you're anemic, it's essential to dig deeper. Anemia in younger people could signal internal bleeding, especially from the colon. This bleeding may not always be obvious, which is why it's vital to pay attention to this warning sign. If you find out you're anemic, don't ignore it. Talk to your healthcare provider about possible causes and next steps. Addressing anemia can lead to better overall health and help catch any serious issues early. Now that we've discussed anemia, let's move on to another important symptom: the feeling of incomplete bowel emptying. What does it mean when you never feel quite done? Have you ever finished using the bathroom but still felt like your bowels aren't completely emptied? This sensation can be uncomfortable and frustrating. It's more than just a minor annoyance. It could be a sign of something serious. This feeling of incomplete bowel emptying is often linked to a blockage or pressure from a growing tumor in the colon. When a tumor forms, it can obstruct the normal flow in your intestines, leading to that persistent urge to go again, even when you've just been. This can create discomfort and disrupt your daily life. If you frequently experience this sensation, it's important to consult your doctor. While it may seem like a small issue, it can be a crucial indicator of underlying problems that need attention. Next, let's discuss another symptom that's often overlooked: unexplained nausea or vomiting. Why could an upset stomach signal colon cancer? Nausea or vomiting can happen to anyone now and then, but when it's unexplained, it can be a sign of something more serious. If you're feeling nauseous without an obvious cause, like food poisoning, it's essential to pay attention. If this nausea is persistent or keeps coming back, it might suggest an intestinal blockage, which can be caused by a growing tumor in the colon. This irritation or obstruction in your digestive system can lead to discomfort and make it difficult for your body to process food normally. Don't ignore unexplained nausea or vomiting, especially if it occurs alongside other symptoms we've talked about. It's important to talk to your healthcare provider to determine the cause. Early detection can lead to better treatment options. Now that we've explored nausea and vomiting, let's move on to another concerning symptom: unintended weight gain, especially around the midsection. Could sudden weight gain be just as concerning as weight loss? Many people think of weight loss as a health concern, but did you know that unexpected weight gain can be just as serious? This kind of weight gain, especially around your midsection, can be surprising but is very real. Sudden weight gain can indicate fluid retention or inflammation in your body. It's essential to keep an eye on this, particularly if it doesn't match any changes in your lifestyle, like your diet or exercise habits. If you notice this weight gain happening alongside other symptoms we've discussed, it could signal an underlying health issue that needs attention. If you experience unexpected weight gain, don't brush it off. Talk to your doctor to rule out any serious conditions. Remember, your health is worth investigating when something feels off. These subtle signs may seem minor, but they can be life-saving if recognized early. Don't ignore what your body is trying to tell you. It's crucial to track these symptoms and talk to your doctor about any changes that last longer than a few days. Early detection can make a huge difference in treatment success. Make sure to schedule routine screenings and colonoscopies, even if you're under 50, especially if you experience any concerning symptoms. Your health matters, so take action now. Let's talk about preventive screening for colon cancer. First, the colonoscopy is considered the gold standard for early detection. During this procedure, a doctor uses a flexible tube with a camera to look inside your colon. It allows them to spot any unusual growths early and can even remove polyps right away. If a colonoscopy sounds too invasive for you, there's another option, the FIT test or fecal immunochemical test. This test checks for hidden blood in your stool and can be done at home. If you get a positive result, your doctor may recommend a follow-up colonoscopy. Another alternative is the virtual colonoscopy. This method uses imaging technology to create pictures of your colon. While it's less invasive, it may still require a follow-up colonoscopy if anything unusual is found. No matter which option you choose, regular screening is key to catching colon cancer early. Now, let's discuss the risk factors you should be aware of when it comes to colon cancer. First up is age and family history. Your risk of developing colon cancer increases as you get older, especially after the age of 50. If someone in your family has had colon cancer, your risk can be even higher. So, knowing your family history is important. Next, let's talk about your diet. A diet high in red and processed meats can raise your risk. Foods like bacon, hot dogs, and sausage are tasty, but can be harmful in large amounts. Try to include more fruits, vegetables, and whole grains in your meals to help reduce your risk. Physical inactivity and obesity are also significant risk factors. Living a sedentary lifestyle means you aren't getting enough exercise, which can increase your chances of colon cancer. Aim for at least 30 minutes of moderate exercise most days of the week. Staying active not only helps you maintain a healthy weight, but also improves your overall well-being. Lastly, smoking and alcohol use are important factors that can impact your colon health. Smoking is linked to many types of cancer, including colon cancer. Heavy alcohol use can also increase your risk. If you smoke, consider quitting and try to limit alcohol consumption to reduce your risk. By being aware of these risk factors, you can take steps to protect yourself and stay healthy. Now that you know the risk factors, let's talk about lifestyle changes that can help prevent colon cancer. First, focus on making dietary adjustments. Aim to eat more fiber, fruits, and vegetables. These foods are packed with nutrients and can help keep your digestive system healthy. At the same time, try to reduce your consumption of red and processed meats. This simple change can significantly lower your risk. Next, incorporate regular exercise into your routine. Staying active is crucial for maintaining a healthy colon. Aim for at least 30 minutes of physical activity most days of the week. Whether it's walking, biking, or dancing, find something you enjoy to make it easier to stick with. Also, consider limiting alcohol intake and quitting smoking. Both habits are associated with a higher risk of colon cancer. Cutting back on alcohol and seeking help to quit smoking can have a positive impact on your health and lower your risk. Lastly, don't forget the importance of routine checkups. Getting regular screenings is vital, especially if you have risk factors. Discuss your screening options with your doctor and stay proactive about your health. By making these lifestyle changes, you can take control of your health and reduce your risk of colon cancer. In conclusion, being aware of the silent symptoms of colon cancer and the risk factors can make a big difference in your health. Remember, subtle signs can often be warning signals, and early detection is key. By making dietary adjustments, staying active, and getting routine screenings, you can take important steps to protect yourself. If you found this video helpful, please share it with your friends and family. You never know who might benefit from this information. And don't forget to subscribe to our channel for more valuable health tips and insights. Trust your instincts and stay proactive about your health. Your future self will thank you.